right, so we now have the abutments positioned in the implants. However, they're not in the proper orientation because clearly we're not going to leave the abutment leaning distally. That's going to be difficult for us to get to. So to assist in redirecting the abutments into the proper position, we have these orientation posts that screw in. And I'm just going to screw all 4 of them in so you can get an idea of what the angulation of the implant is. All right. So here you can see that we've got the implants distal angulated. The anterior implants are more or less straight up and down. And so now we need to decide how we want these oriented. And these orientation posts are 15 millimeters in total length, right? So from the implant platform to the top is 15 millimeters. And that's because these types of restorations really ought to have about 15 millimeters of restorative space. And so you don't want these posts to be too long. Otherwise, when you do your checks for your orientation, the length of the post can get in the way. So now that I've got these oriented pretty much how I think they should be, now I would just rotate the patient closed and see where it is on the opposing tooth that these posts hit. In a mandibular setting, what I'm looking to accomplish is to get this post to come through the center of the occlusal table in the posteriors and the cingulum of the anterior teeth. So in the maxilla, I'd want this part of the post to hit the lingual cusp of the maxillary posterior tooth on either side and the cingulum of the maxillary anterior tooth. So when the patient closes down, if these posts are now hitting that landmark, great, I'm good to go. So then I just remove the orientation posts. And then I torque it in at that orientation. And torque it to 25 Newton centimeters. Torque to 25 Newton centimeters there. And then we'll torque this to 25 Newton centimeters. And lastly, this one gets torqued to 25 Newton centimeters. Stop there. Now you can see on this torque wrench that we've got 15, 25, and 35 indicated. So the 35 is for driving the abutment to the implant. 25 is for securing the orientation screw in its desired position at 25 Newton centimeters. And then we're going to torque the prosthetic screw to 15 Newton centimeters. So let's move on now to delivery of the provisional restoration.